Welcome to tonight's webinar, Domestic Violence Through the Lens of Law Enforcement During a Pandemic, part of the One Community Amplifying Equity series. Tonight, we will talk about the things that need to be talked about. So please share this webinar and let everybody know we are live on Facebook. I want to say thank you to our sponsors, Delta Sigma Theta Sorority Las Vegas, Nevada Minority Health and Equity Coalition, UNLV School of Public Health, Katrina Halsett, MD, PC, OBGYN, Health Plan of Nevada, Care Coalition, and Compassionate Las Vegas. This is a webinar event focused on the impact of COVID-19 and its results on the African American community. Be sure to register for the two upcoming events on April 21st and May 19th regarding COVID-19, fact or fiction. You can register for these events by visiting nmhec.org/events. Again, you can just go to our website, nmhec.org/events, and register for the upcoming webinars. Now, before we start today's event, we have a few guest speakers who will provide welcoming remarks. One of the sponsors of today's webinar is Delta Sigma Theta Sorority Las Vegas chapter, and we have the organization's president here with us today. So please do a warm welcome for President Belinda Morentic.
Good evening, and thank you, Will Rucker, for that amazing introduction. My name is Belinda Morentic, and I am the president of the Las Vegas Alumni Chapter of Delta Sigma Theta Sorority Incorporated, and I'm honored to say a few words on behalf of our chapter for this event. We are thrilled to partner with UNLV to address the issues that are continuing to grow with minority health. LVAC, as we call ourselves, has a 5-point programmatic thrust. And physical and mental health is one of those points that we continue to focus on to educate our community. Our topic this evening, as was previously stated, is domestic violence through the lens of the law during the pandemic. And we have an amazing set of panelists that collectively are a wealth of information in a variety of areas to address this growing topic. Please feel free to ask questions this evening in the chat. We would love to interact with you. And we just, again, want to say thank you for allowing us this opportunity to participate and to collaborate with such a great organization on the campus of UNLV.
All right, well, thank you so much for your remarks. We are so glad to have you with us. And of course, to our audience, thank you for being with us tonight. Again, let everybody know we are live. They don't want to miss this information. Even if you think, oh, I don't know if that's really relevant for so-and-so, it's relevant. We all need to know about this. So I am Will Rucker, and I'm so excited to be the moderator for tonight's webinar. We have a special video from Congresswoman Susie Lee, so please take a look.
Good evening, everyone. I'm Congresswoman Susie Lee from Nevada's 3rd Congressional District, and thank you for inviting me to your monthly meeting. I wish I could be there with you in person. Hopefully next time we will all be in the same room. Tonight, as you discuss domestic violence as it relates to COVID-19, please know that you have a strong ally in me. The protection of women and children isn't and shouldn't be a partisan issue. In fact, it's a moral issue, and it is a shame that the Violence Against Women Act has been so instrumental in directing our national response towards domestic violence and against sexual assault, which is why it's shameful that partisan politics in Congress have resulted in this important program expiring. This past year has only demonstrated just how important or how much there is such a continued need for the Violence Against Women Act, as we saw a sharp increase in intimate partner violence. I was proud to pass the Violence Against Women Reauthorization Act, and I hope that our Senate colleagues will do their part to ensure that every survivor receives the resources they need to live a life free from fear and violence. This new bill builds on previous versions of VAWA by making investments in preventing domestic and sexual violence and providing crucial funding to programs supporting survivors of sexual assault, domestic violence, dating violence, and stalking. I'd like to thank the Nevada Minority Health and Equity Coalition and the Las Vegas Alumni Chapter of Delta Sigma Theta Sorority for hosting this meeting and discussing this important issue that unfortunately affects so many families in our community and in our state. And if there's ever anything I can do or any information I need to know, please do not hesitate to contact me or my office at 702-963-9336. Working together, we can make a positive difference in making sure that everyone can live the life that they deserve. And again, thank you for inviting me, and I hope you have an excellent meeting.
All right. Well, thank you so much, Congresswoman Lee, for your special message. And as you've heard, tonight is all about domestic violence, and we have to talk about it. So let's get our first speaker on the line here, who is none other than Michael E. Blow, who is a 35-year law enforcement professional. He currently serves as Deputy Police Chief Field Operations for the Henderson Police Department. Previously, he was a member of Prince George's County MD Police Department, retiring at the rank of Deputy Chief of Police. As the Chief of Patrol, he commanded 1,100 officers and directed strategies that resulted in a significant reduction of citizen complaints, increased productivity, and a 50-year low in criminal incidents. As a district commander, he was issued a proclamation from the Prince George's County Council for innovative and effective crime reduction initiatives. Michael held several critical positions within the agency, including Chief Strategic Management Bureau, Patrol District Commander, Office of Intelligence Commander, Protective Services Community Policing Supervisor, Police Academy Survival Tactics Instructor, and Patrol Officer, and the list goes on and on. After his tenure with the PGPD, he was appointed as the Director of Security Services for the Prince George's County Public School System. At that time, the system was comprised of 124,000 students, 18,000 employees, and 205 schools. Michael developed strategies that resulted in historic reductions in disruptive incidents and managed the implementation of a $7 million security technology enhancement initiative. Michael holds a Bachelor of Arts degree from the University of Maryland, Baltimore County, and a Master of Science Management from Johns Hopkins University. He is a member of the International Association of Chiefs of Police, Police Executive Research Forum, National Organization of Black Law Enforcement Executives, Alpha Phi Alpha Fraternity, Inc., and 100 Black Men of Las Vegas. He has been featured in numerous media venues, including CNN's Situation Room with Wolf Blitzer and 360 with Anderson Cooper. So with all of that, give a warm welcome to Chief Blow. You have the room.
Thank you, sir, and thank you for the introduction. And I'll be very brief, but I'm so happy to be here to have this conversation and be a part of the discussion this evening. And as we all know, domestic violence is a challenge that all of us wish would disappear. It impacts races and communities and income levels, regardless of the spectrum. So in essence, there isn't a community or a place in the country where you unfortunately will find domestic violence. So I'm just honored this evening to be here, to be a part of the panel, and to be a part of the discussion. And hopefully we'll have a very robust conversation and even come up with a few strategies and ideas on how we can continue to eradicate this issue. And thank you again for having me.
Thank you so much, Chief Blow. We are so grateful you are here with us tonight and bringing your expertise to us here in Las Vegas. Next is the Honorable Jasmine Lily Spells. She is the newly elected judge in District Court Department 23. She shares the title with a colleague of being the first Black woman elected to the District Court bench without an appointment from a governor. It's a huge achievement. Prior to taking the bench, she protected the constitutional rights of the indigent as a chief deputy public defender. She has served as a court-appointed special advocate, advocating for the best interest of abused and neglected children within the court system. A wife to a Navy veteran and mom of four, Lily Spells is passionate about children and loves volunteering at our local schools. She has mentored teens and young attorneys, as well as served on multiple school committees. In her spare time, Jasmine loves to dance, to travel, and most of all, to spend time with her family. Turn it over to you.
So it doesn't appear that I'm able to start my video. I don't know if the host can restart the video.
Yeah, we'll get you going here. Give us just a second. Hey, this is Zoom. This is, technology at work. So we'll make sure we get things going.
There we go. Good evening, everyone. I'm Jasmine Lily Spells. I am the District Court Judge in District Court Department 23. I am happy to be here with all of you tonight to discuss a very important topic that affects all of us. I think all of us has known someone who's been affected by domestic violence or had an experience. And so it's very important that we start opening up this conversation and not having it be something that's taboo, that we're not talking about, and discussing ways that we can definitely assist others and make sure that we are doing what we can to reduce the level of violence within our communities. So thank you so much for having me. It is a pleasure and an honor to be here to speak with all of you, to learn from you, and to give you some information and share what I know about the topic. I look forward to our conversation. Thank you.
Thank you. And I just want to echo, we are going to ensure that this topic is no longer taboo. Again, we're going to talk about the things that need to be talked about. Our next speaker is Brianna Bauer. She joined the Legal Aid Center of Southern Nevada in 2018 as a staff attorney for the Family Justice Project, representing victims of domestic violence in divorce, custody, and child support matters. She graduated from IIT Chicago-Kent College of Law with a Juris Doctor degree in 2018. While in law school, she interned at the Legal Counsel for Health Justice and as Northwestern Memorial Hospital's in-house counsel. She also interned for Chicago-Kent's Family Law Clinic and Alternative Dispute Resolution and Mediation Clinic. Brianna received the Dean's Certificate of Service for her volunteer legal work as a student manager at the Self-Help Web Center, a student-run help desk, and for her service work in New Orleans as an active participant in the Student Humanitarian Network. Prior to attending law school, she graduated with high distinction from Pennsylvania State University with a degree in health policy and administration. The floor is yours.
Good evening, and thank you for having me here tonight. Again, I am an attorney through the Legal Aid Center of Southern Nevada, and we do assist low-income clients and survivors of domestic violence in, as was stated in my introduction, custody, divorce, and protection order cases. During the pandemic, we have seen an increase in these cases, and we continue to represent those clients in the community. And we are very excited to be here tonight in order to share the information that we have, provide any resources that we can, and to participate in this discussion regarding the very important issue of domestic violence in Nevada's community. So again, thank you for having us present here tonight to participate in the panel.
Thank you so much for being here. We can't wait to hear more from you. Next will be Ms. Angela Brock, affectionately called Angel. She's been in the nursing field along with other health-related fields for over 20 years. She started her career in the United States Army as a medic and is now an advanced practice registered nurse, family nurse practitioner. She is also the owner of Edge Nursing Consulting, LLC. Angela has a bachelor's degree in business administration, holds a master's degree in health administration, and has achieved her master's of science degree in nursing, family nurse practitioner program at Samuel Merritt University. Angela has 2 children, 2 granddaughters, and we can't leave out King Bailey, her very active puppy. She has lived in the Las Vegas area for 21 years and serves as an officer on 2 executive boards, Southern Nevada Black Nurses Association and Montara 3 HOA. Lastly, she mentors and speaks to teenage students on health-related safe behaviors. Please, the floor is yours.
Good evening. Can everybody hear me? My video is not working right now.
Well, you're coming through fine. Thank you.
Okay, good. So thank you for inviting me to this very a special topic and a very important topic to get out to the community. It is very imperative that people understand from a medical standpoint on exactly what domestic violence victims or survivors go through. I myself am a survivor of domestic violence, so it is definitely something more dear to my heart. And I again look forward to this conversation. I appreciate the invite, and I'm looking forward to expanding my knowledge on how to really help those that come into the medical community for help with domestic violence.
Thank you. We really appreciate you being here tonight. Next is Dr. Jacobs. Dr. Jacobs is a licensed marriage and family therapist. His bachelor's degree is in communications from The Ohio State University, and his master's and doctorate degrees are from Alliant International University School of Professional Counseling. Dr. Jacobs has been providing individual, couples, and family therapy to individuals from various walks of life for the past 15 years. He is a team clinician for the Las Vegas Raiders, where he provides counseling to players, coaches, and staff, as well as conducts NFL mandated trainings for the team. Dr. Jacobs is also a mental health media consultant for Las Vegas Fox 5 News, Las Vegas Channel 13 News, Power 88.1 Las Vegas, and the Las Vegas Review Journal. He was appointed by Governor Steve Sisolak in July 2019 to serve on the State Board of Nevada Examiners for MFTs and CPCs, and he is the Vice President on the NAMI Southern Nevada Board of Directors. Lastly, Dr. Jacobs has been recognized for his efforts spreading awareness for mental health and homelessness in the Las Vegas community. Would you please share a few words with us?
Yes. First off, I'd like to say it's an honor to be a part of this tremendous event. It's also an honor to be a part of this esteemed panel. And so thank you to everyone that was involved in putting this event on. One thing that I want to add is, I'm also a survivor of domestic violence. And what was interesting about my experience was that the first time the police came to my home due to a domestic violence dispute, I had, scratches and bruises all over my face, all over my body. I remember the police came out and they thought they didn't think I was being serious. They wouldn't take a report. They really just minimized the whole situation. And it was something that really left, a bad taste in my mouth. It was something that I really struggled with for a long period of time, because I can even imagine what, survivors go through, and just the feelings that they have, when it comes to domestic violence, and like we mentioned earlier, the taboo piece of it as well. So my hope, my wish, my prayer, after tonight's discussion is that we're able to more openly talk about domestic violence and its impacts, and also for us to come up with some solutions to help combat this very serious issue. So again, thank you. I'm glad to be a part of this wonderful discussion, this important discussion.
Well, thank you for being here and for your transparency and sharing your story. We don't often hear about the story of male domestic violence victims. or survivors, I should say, apologies. But it's important to highlight that we do exist. So thank you for that. Our next speaker will be Angela Reyes, who is the VP of Prevention and Education at SafeNest, providing the most up-to-date, data-driven domestic violence training in the state of Nevada. Angela feels her work allows her to make the largest impact by training individuals and organizations to work in the greatest trauma-informed manner and to serve victim survivors with the utmost respect and dignity. Angela has worked in the nonprofit sector for over 25 years and graduated from California State University at Bakersfield with a bachelor's in criminal justice and a master's in educational counseling. Angela is married and a mother of two, which she considers her greatest achievements. Angela, would you please share?
Hi, thank you so much for having me. Again, my name is Angela Reyes. I'm a VP of Prevention and Education with SafeNest. I'm honored to be here. It is absolutely a privilege to be having this discussion with such an amazing set of panelists. Thank you so much for allowing SafeNest to be a part of the discussion this evening. And I'm looking forward to learning more and offering an opportunity for other individuals to get involved with SafeNest as a volunteer, as a donor, however I can get you to provide some added service and expertise. So thank you so much for having me.
Yes, thank you for being here. All right, with introductions out of the way, it is time for our conversation. So I would like to invite all of the panelists to turn on your cameras if you are able, and we will dive into this topic. Our first question is very simple, but I think it's important to set the foundation for tonight's discussion. And that is a question around shame. And so the question, whoever wants to take it, go first, dive right in, is how do you overcome any associated shame with experiencing domestic violence?
I'll take the question. I think that it's extremely important to find a support group when you are going through anything. And in fact, I don't think that you should do life by yourself at any time period. I know that many individuals who are in relationships where there are threats of violence, sometimes we see that the partner who is being threatening will try to isolate them and prevent them from having family or having friends. But when you're going through that, and if you're trying to recover and on the other side, I think it's really important to find resources within the community, people who have gone through that same experience, and definitely to start reaching back out if you've lost contact with family members, friends, because having that support is really what is going to get you through. Having other individuals who can encourage you or who can lighten the load if you are an individual who is going through domestic violence and you have children, or you're having problems with rent, basic needs, food. So I think that support group can not only help with the day-to-day things, but they can also remind you that you are loved, that you are important, that you are significant, that you have things to offer to other people, that your life is meaningful. And that in and of itself, if you can start to grow that self-esteem and recognize who loves you and that you are worthy to be loved by yourself, then that I think will minimize and eliminate those negative feelings of shame or unworthiness.
Brilliantly stated. I think you really hit on so many important points. And what you bring up for me is another way to set the level, which is how does one really know that they are experiencing domestic violence? What is the minimum threshold, we could say, for that?
Hi. I think, again, you're absolutely correct. I think there are certain communities that do not identify certain things that happen as domestic violence. I think education is the #1 component, even when dealing with shame, right? I think organizations, people in the community, your neighbors, your churches, anywhere that you frequent, if they have the education, just the bare minimum of what domestic violence is and what it could potentially look like, I think we could absolutely minimize the shame of people saying, I'm going through something and I don't know what it is. Again, domestic violence is not always physical, right? It's emotional, it's financial, anything that's causing distress, things that cause someone from stopping from doing things involving isolation, finances, an allowance, right? You can't wear makeup, you can't wear those clothes, you can't leave the house, no, you can't see your mother, right? There are just numerous layers of domestic violence. And again, I think in a lot of minority communities and underrepresented communities, we see that as this always happens, right? My dad did this. My grandpa did this. These are the way my uncles talk, So again, it's the education component that we're lacking in our communities that we need to be able to have these conversations. And that's coming from a domestic violence organization. And this is what we do, right? We have to educate grocery store attendants, here in Las Vegas, we're talking, hotel staff, casino staff, identifying things, looking at things, very numerous ways to begin the conversation.
So simply because it's a cultural norm or normal to you doesn't mean that it's healthy or should be accepted. Is that what I just heard?
Correct. And I think that even as little people, right? I have worked in the nonprofit field. I've worked at shelters even prior to Safe Nest, and you could even see the continuum, right? These patterns, these ongoing cycles, generational cycles of abuse. And the kiddos are saying things, don't look at my sister, don't look at my mom. They don't realize that we're doing the same patterns, right? We're experiencing the same things. We're doing the same things over and over, and we're not even able to identify those things. Education.
Yeah, that's huge. And I hadn't even considered how young it really does start, but you're absolutely enlightening us tonight. So thank you for that. And audience, attendees, I want to encourage you to submit your questions. This is a conversation. I don't want to have to jump through the screen and grab you, right? We don't want to do that. So please submit questions, and we love to make this a conversation with everyone involved. So I'd like to turn to Dr. Jacobs and just have you share your thoughts on this subject.
Yes, most certainly. So, obviously this subject is very near and dear to me, just based upon my past experience. This is a relationship that I was in that was, that contained a lot of domestic violence. And it was something that was really challenging for me as a male, because a lot of my friends didn't take me serious. Law enforcement didn't take me serious. And so what I ended up doing was keeping it to myself, right? I kept it all sort of bottled up inside in terms of everything that I was dealing with. And it became very, very difficult for me because I felt like I didn't have anywhere to turn to. However, my brother, who was, like I said, like my best friend, he was pretty, receptive and supportive of me. And this kind of goes back to the point where we were talking about, awareness and talking, and having those outlets. And so I think it's important that, survivors, have, that safe outlet, or that safety blanket, if you will, of individuals to go to talk to, because a lot of times, especially when we're talking about communities of color or people of color, a lot of times it's more challenging or difficult to reach out for help outside of your support system. I think there's a lot of cultural factors there that makes it difficult for people of color to feel comfortable with reaching out for support. And so one of the things that I always suggest is who's that one person or that group of people, women, men, or it'd be somebody, a group at church, who met whoever, where you can go to or turn to when it comes to dealing with a situation or a relationship that's violent in nature. And like I said, violent could be violence. There's violence, has so many different layers. Which was alluded to earlier. And so it is, a lot of times we think of domestic violence as the physical piece, the physical abuse, but it's psychological, it's emotional, it's financial, it's sexual, right? So there's all these different factors. So for me, it hits close to home. Also, as a clinician, I work with a lot of clients that are victims of domestic violence. And so hearing their stories, especially during this time with the pandemic, one of the things that I've learned through this pandemic is that the inequities when it comes to just a crisis becomes that much greater. That's one hard truth that I've learned, is that these inequities when it comes to the social determinants of health, the social determinants of mental health as well, have become wider because of the pandemic. And then also when it comes to just sheltering in place, that looks different for all of us. Right. Because I can say for myself, this pandemic has been a blessing in disguise for me, because I've been working from home 95% of the time. And so I've been able to spend more time with my family as a result of that. My wife's already a stay-at-home mom. My kids are in private school. And so we didn't really skip a beat. However, that's not the case for most people. You're talking about these other social factors when it comes to trying to find childcare, when it comes to all the different financial stressors, job loss, neighborhood violence, all these different things that are that kind of hit during this pandemic has really made us realize that, wait a minute, we have a lot of different things that need to be addressed in our community, and this pandemic has only shed more light on some of those things. So those are my thoughts.
Thank you so much for that. And I'm glad you brought up this pandemic aspect, because things are just different. And I am fortunate to live in a situation where I enjoy being at home. I've got my puppies and my fish and all of those things that make life great. And I could not imagine what it would be like to be trapped in my home with someone that is perpetrating domestic violence. So thank you for introducing that to the conversation. So Nurse Angel, can you share your perspective on what domestic violence looks like in this pandemic era?
And it's a little terrifying for women, definitely. And there was a recent report from Las Vegas Metropolitan Police that domestic violence went up to almost 20% during this pandemic. People of color, unfortunately, were the highest number, African American women, Hispanic women, as well as pregnancy. Women that were pregnant definitely went through it. And the most horrifying thing for women or anyone that's in a domestic violence relationship is going home behind that closed door. And a lot of them don't come to the medical facilities asking for help, because more times than many, that person that is the assailant or the person that's doing domestic violence on that person is right there. They will not let that person be alone in a room with anyone during the assessments. When we're talking to these women, we may see bruises on them and they'll go, oh, well, I fell down, or I walked into a door, but yet you have fingerprint marks around your neck. That's not consistent with the assessment. So sometimes as nurses, we have to, or anyone, any clinician, and now that I am a clinician as a nurse practitioner, you learn to separate them. And when you separate them, you use the excuse of, I got to take them down for the labs. I got to take them down for x-rays. But you use that time to have that conversation with the lady or the man, because I have seen men as well as domestic violence survivors. And I think men go through it so much worse than women, because when you think of domestic violence, you tend to think of mostly women and them being at home with the abuser. So you never really sometimes even sometimes in our education, they don't necessarily touch on men a lot. I think this past year, definitely it was something that we have had courses in that is educating us more on, identifying that men too go through domestic violence. And it seems a lot harsher when you're thinking of men going through domestic violence than women, because when that man comes home and he's tired and he's coming from work, or if he's in the household with this person, she's thinking of ways, or he, if they're in a LGBTQ community, that abuser is thinking of ways of how to hurt that person. If that person's asleep in the bed with next to them, they're putting a pillow over their head, or they're locking them in the bathroom, or I even seen a case where they put fecal material in that person's food. So it really plays a lot, and it stresses people out. And I know a lot of us are going through COVID, PTSD or fatigue, but just think of the fact that you have that along with the stressors of not having any finances coming in. You may have lost your job because of this COVID. Like some people, they weren't getting their unemployment like they should, and that's adding more and more stress. And I've seen it where it's gotten deadly to the point where the abuser is taking a knife and poking the person. And this person doesn't want to say it. And unfortunately, with some of the things that I learned is with domestic violence, and I don't know if the statute has changed, and I pray that it has changed, but it's not a mandated reporting at all. They look at it not like they were a vulnerable population. And if it's a pregnant woman, absolutely. I have to call Metro. I have to bring in Metro. If it's a child, I have to bring in Metro. But if it's someone like me or Dr. Jacobs, it's something that we are told that we cannot report, and we have to kind of fish the information out of the person that's being abused, and that person is terrified. Like I seen a woman break down and cry when I was talking to her, trying to fish out the information. Luckily for her, there was a counselor there, and I was able to get the counselor to come and have that conversation with her. And the other problem is also people are relocating. So they're becoming nomadic with this domestic violence. So they're taking one situation out of one state and coming into a new state. They don't know anybody here. They have no support whatsoever, but they're stuck in this house with this abuser, but they don't have no one to turn to but the medical community.
Wow. This is, heavy, heavy, heavy stuff. And when I started, I'm excited to talk about it. And the reason why is, as Angela mentioned, you got to educate. So knowing what's happening, being aware of what is around us, what could be happening right next door, is how we help to move this ball forward and create change in our communities. So since we have a question about the legal aspects, I'd like Brianna Bauer to come in and share. And then also, in addition to the reporting requirements, if you could just share how law enforcement is partnering with community resources or nonprofits to provide support and address these issues.
Absolutely. So here in the legal community, we've also been impacted, or our clients have been impacted by the COVID pandemic. So as has been discussed through this panel, there has been a rise in domestic violence incidents being reported during the pandemic. And while we are still representing clients, this has also posed challenges for many of our clients. We've seen a pattern of individuals who may have decided to separate or move or pursue divorces, potentially not move forward with pursuing divorces due to the financial implications and things of that nature, and all of these other factors that influence our clients' decisions moving forward with whether to pursue divorces, pursue custody cases. Further in the legal community, we're continuing to represent our clients in those domestic violence protection order cases. And we are fortunate to be partnered with many other, at Legal Aid, partnered with many other community resources who refer clients to us either through emergency protection orders or from community partners to be connected with those individuals in the community to assist in representing them in those protection order cases. When it comes to involvement with the law enforcement in the community, there has been a partnership with the community for a while. We do work closely with the Family Justice Center, which is known as one of those a one-stop shop for information for individuals who are survivors of domestic violence and seeking orders of protection. They can also be connected with Metro in order to file reports. And at Legal Aid, we also have a partnership where attorneys can help to give legal advice or information to individuals who are survivors of domestic violence. So whether it be where to file for an order of protection, how to pursue cases, or even how to end a lease if they have been a victim of domestic violence and be free of that lease so that they can move away from their abuser. Those are all resources that we've partnered with prior to the pandemic and continue to partner with as we move through COVID-19 and moving through this pandemic.
Yeah, we'll make sure to share those resources as well. So thank you for that.
Absolutely.
Continuing along the line of law enforcement and how we deal with this, I'd like to invite Michael Blow, Chief Blow, to share your perspective, particularly around any changes in patrol response due to COVID, because of course, social distancing and all of these protocols are in place. So how does law enforcement address it in these times?
Sure. Well, you know, with law enforcement and with all of public safety, you know, we're using the protective equipment that is recommended by the health officials and so forth. But in terms of handling domestic violence situations, we continue to handle them right by the numbers. You know, we go in, we attempt to figure out exactly what's going on. Certainly, if we don't see obvious signs of a struggle or some type of physical assault, we attempt to diffuse and make the appropriate referrals and those types of things. But certainly, even in the COVID environment, if we encounter a situation where there's obvious physical trauma, we will make a full custody arrest and handle that situation right by the numbers. And so, and as the rest of the panel said, unfortunately, there has been an increase nationwide with domestic assaults and domestic violence, and unfortunately, domestic related homicides. And so that's certainly something that has not respected the whole COVID environment, and we continue to respond to those situations. We've attempted to be proactive by putting out messaging that encourages families that may have challenges around domestic violence and some of the contributing factors, you know, telling them places where they can receive assistance and counseling and the like, because as everyone has indicated, COVID has been such an unusual trauma for everyone. And in particular, when you have a family that not only with the challenges of the impact of the economic situation on the home, but again, if you think about mom and dad are trying to conduct Zoom meetings and the children are trying to learn online, there's not enough bandwidth in the house for anyone to do anything. Tempers are flaring, and you know, it's just very frustrating. And sometimes those things have been some of the culprits that have led to domestic violence situations. And we also have to understand that domestic violence doesn't just happen in the house. It can happen at the mall. It can happen in traffic. It can happen anywhere, in the grocery store. And when we take it back to the home, it is very challenging for law enforcement across the country, because you can't post an officer outside of the bedroom door or outside of the kitchen. And, you know, so that creates another challenge when when you receive that call that is a domestic violence situation or a situation that has the potential to escalate to domestic violence. But to answer your question, we have not changed our responses. We continue to respond. We continue to document those situations. We continue to provide referral information and whatever other assistance we can provide for that family or for those individuals that are involved. But also, we also will not hesitate to make full custody arrests when that situation is appropriate.
Thank you for sharing that. And just to follow up, one of the things that concerns our community is the high level of domestic violence within the police force. And as a reverend, I would also add within religious institutions. So what would you say to those that acknowledge that perhaps the helpers are hurting or guilty of the same thing that they're experiencing? How would you encourage that person to reach out for help?
Well, you have to understand that you're talking about the human element, and pain knows no boundaries, suffering knows no boundaries, and trauma knows no boundaries. So even when we have members of law enforcement or doctors or lawyers or whoever we encounter, again, we go by the numbers. If we can offer assistance, we offer it. If there are referrals that we can make, we offer it. If we can be proactive, if we see the signs that many of the professionals here have indicated, we'll take the appropriate intervention steps. But also, no one is above the law either. So if we find that we get to a situation, even if it's involving another law enforcement official, and we see the signs of physical abuse, again, we will take the appropriate action, and that may include a full custody arrest. So again, no profession is exempt from the realities of trauma and the realities of suffering.
Yeah, that's so true. And it's just important for everyone to hear that. And I'm sure you offer programs where you help your officers in their own relationships and provide services in that way too. So thank you for bringing that to light. I'd like to turn our attention back to the emergency room, because you brought up such a great point. I call you Nurse Angel, with how you have to be so strategic. And this is really for the panel at large, but starting with you, what are some ways that we can better partner where a nurse will maybe see something, and if she or he does not have a counselor standing by, what are some ways that we can improve that situation? And then from the counseling side, how can we better partner with our medical professionals in those instances?
I honestly think that every hospital should have at least a pastor or a chaplain or someone available to nursing staff to help with those types of situations. Because nurses can get abused by the abuser if that person feels like we're digging too much. Like I've been in this field, of course, like over 20 years, so, or now 25, but I've seen nurses where they've asked questions and the abuser didn't like it. And matter of fact, there's a video of that person attacking a nurse with an IV pole. So some hospitals do have security on staff. I believe the majority of those here in Southern Nevada do. I did work at UMC for some time, and UMC does have security on staff. So that helps a lot as far as having other auxiliary services such as counseling, things like that. That is something that the medical field, or I should say, even as nurses, we should definitely encourage the hospital to have, is having someone where we can call immediately and that person's on call and that person comes to the hospital to help, whether it's an attorney, whether it's a counselor, whether it's a pastor, because everybody works. Some people work from 8 to 5, and we do respect that. But domestic violence has no time. It happens 24 hours a day. So if we could have someone that we can reach out to in cases like that, and very discreetly, Like, I know like we have codes and some people are like, well, what's a code blue or what's a code gray? Nurses, we joke and say code brown when somebody pooped on the floor and we have to clean them up. But we should have like certain code words to trigger where the doctors as well as the nurses know what we're talking about, but the abuser or even the person that is being abused don't know that we recognize some red flags and we're calling this code because now we need to get security down to the wherever the unit is, whether it's the emergency room, whether it's the med surg unit, wherever we're at, and have security ready to go or already have the police en route, as well as having an attorney ready to help with protection orders and things like that. But also we are in a catch-22. Most abusees or people that are going through domestic violence sometimes go right back. Is sometimes a very vicious cycle. So it's a catch-22 sometimes for us, even though we're trying to help. Some people get angry at us for trying to help, and sometimes that runs into a whole nother subject in itself, but we also have to be cognizant of that as well. But I think if we could collaborate with somebody with having that type of resources, it would definitely help. And it would actually help streamline it a little bit better, where there's not this choppiness where now we got security coming, then we got the police coming, and then now that person has to wait a whole morning or another 12 hours to get in touch with an attorney, that because that office doesn't open until 8 or 9. Or like maybe getting in touch with the shelter or other things like that. So I think if we could come up with some kind of streamlined code, like what we do with our code blue, then I think that would also help anybody in a domestic violence situation.
Yeah, those are so important for us to consider the full wraparound, not just the Band-Aid, but actually addressing the full issue. Dr. Jacobs, what are your thoughts?
Yeah, my thoughts are, I mean, obviously, Chief Below, I think, touched on some, I mean, everybody's touched on some really good points, but Chief Below, some of what he mentioned really struck me, and that is when it comes to looking at professionals, even, I think a lot of times we don't talk about those that are on the front lines, that are, whether it be treating or supporting those that are dealing or experiencing domestic violence. And so one of the things that we found, and this, I'm speaking more or less with excuse me, my organization that I oversee, National Alliance of Mental Illness, NAMI. One of the things that we've learned over the years is the peer-to-peer, the importance of peer-to-peer. So if we're talking about law enforcement, we're talking about nurses or doctors, one of the things we found out is if somebody's experiencing a situation, or if it's domestic violence, if it's some level of trauma, or some psychological distress, whatever the case may be, that a lot of times, people that are in these type of professions are more likely or have more of a proclivity to attend a support group where there's other professionals that are in that group, that are in that group. So for instance, for law enforcement, one of the things that we've been working on, we created a first responder group as it pertains to COVID-19, so everything under the sun. And so one of the things that we have facilitating those groups are officers and nurses, because the likelihood of other nurses and doctors and law enforcement personnel talking to somebody that looks like them, kind of like the laws of attraction, right? I mean, that's very real. So they're more likely to go to a peer versus a professional that they do not know, right? I mean, obviously, as a clinician, we want people to seek the support and seek the treatment that they may need based on whatever they're going on. We want that, but the reality is that that's not always the case for many different reasons, whether it be cultural reasons, if it's trepidation, if it's there's a number of factors that prevent individuals from really seeking the help or the support that they deserve or that they need. And so so that peer-to-peer piece is very, very important. And again, I think the conversations we're having today, I mean, this platform is tremendous because I think the more we talk about domestic violence, just like anything, just like mental health, just like trauma, the more we're going to chip away at those stigmas that exist. And it starts with awareness. I mean, we can't effectively intervene without awareness and education. So it really starts there. That's why I'm happy that we're having this conversation. And I want to keep this momentum going. Like, I don't want it to stop here. Obviously, you know, April is Stress Awareness Month, and we know that stress is one of the leading factors as it pertains to domestic violence, right? And so one of the things that, you know, we'll be seeing a lot throughout this month is, you know, the focus on stress and stress reduction and how to take care of ourselves, and, you know, looking at some of those social determinants that are very real, right? And we've learned that throughout this pandemic, you know, those social determinants have become even more, you know, real and broader, and have been compounded on so many different levels. So again, it's important that we continue to have this conversation.
Yeah, thank you so much for that. And why don't we just all as a group take in 2 or 3 deep breaths. Just breathe in through your nose and release. Breathe in through your nose. Just got to reset that vagus nerve system. Got to do that, you know. So speaking of vagus, right? I want to turn to Angela and Safe Nest. What have you seen regarding tourism and domestic violence, or our visitors?
Yeah, no, absolutely. Obviously, now that we're opening back up and we have an awful lot of patrons coming to Las Vegas. And as you hear on the news every weekend, right, there's something going on down at the Strip and down in Fremont Street, downtown area. We're seeing a lot of action going on. Again, I think it's a combination of a lot of things. Obviously, alcohol doesn't help any situation, right? I think alcohol in any person could cause issues, but if you're adding alcohol to someone who has violent tendencies already, we're just adding fuel to the fire, right? And again, so many people have been out of the loop of, you know, socializing and, you know, going out and doing all these other things. People are coming to Las Vegas and kind of cutting loose. So absolutely, I think there's a combination of a lot of different things happening, and definitely IPV is one of them, right? Intimate partner violence, where we're coming out with our friends and our family, and, you know, one thing leads to another, or someone tries to talk to someone else and we end up having a fight, or God forbid, something worse. And so, yeah, I think definitely tourism, alcoholism, you know, drugs, any kind of anything only adds more and more stress, causes more and more anxiety and fear. And we have explosive situations that happen. One of the other components that we kind of talked about on the panel, who are phenomenal, grateful to even be able to be on the same call. SafeNest has a program called PS 417 where we respond with Metro on domestic violence calls that 9 times out of 10, the abuser is arrested. Just like, you know, Nurse Angel has identified that the importance of offering services immediately is phenomenal, right? That 12 hours that it takes for that organization to then open and receive service, you lose too much during that time, right? Because now that victim has gone back home. That victim has now been potentially abused again, if not killed. And now we're waiting for a protection order. Let's talk about the courts only functioning at a percentage at this very point in time, even a year and some months later. So programs like SafeNest have a 24-hour hotline. We respond with Metro even to offer the immediate resource of a hotline number. Our hotline is able to offer emergency temporary orders over the phone. So those are resources. And again, I go back to the education component, right? I would love to get my prevention and education team at the hospitals. We need them out on Fremont Street, right? We need these tools and these pieces of information to be everywhere. At the grocery store, at places of worship, anywhere, because I don't care what victim goes to anybody at this point to divulge information about domestic violence and IPV, sexual assault, I'm going to then be able to call, that person can call Safeness for that victim and say, hey, I have a young lady, I have a young man here. We need some services and we need it immediately. Our hotline is 24 hours a day. Our services have not stopped. Safeness has seen an increase in calls with Metro for domestic violence calls. We've had increased numbers in our shelters. Our bed nights have just skyrocketed. I think everybody can agree that things happening in the home are adding more stress. Income, we talked about income. We talked about childcare not being open. Schools aren't open. So now kiddos are home. They're bored. They're hungry. There's no unemployment money coming in, right? If we see a stimulus, where does that go? Bills, right? We have to keep the bills going. Stressors and alcohol. And what was they were delivering alcohol during this pandemic, right? Nobody talked about delivering diapers until recently. Nobody talked about a drive-through, diaper drive or food, or, the schools were doing what they could with lunches and breakfasts, but they were delivering alcohol. So again, we're just, our priorities again are just a lack of education, lack of preparedness, and lack of resources. So, just again, I can't stress the education component enough. I live and breathe it. So I would love to offer anything that Safeness can do for anybody on the panel, anybody on Facebook listening, anybody with any questions, please reach out to Safeness. We'd love to help.
Yeah, I can feel your passion even through this virtual space. And I'm on my best behavior because President Morentic is on the call today. But I do have to ask this question, and it's around a systemic change, which would be universal basic income or a freedom dividend or whatever you want to call it, but providing a meaningful monthly or however that works out, stipend, income, whatever you want to call it. What would that do for those experiencing domestic violence? And that's for anyone that wants to take it.
I'll take it. I think it would definitely help cut down on the stress because, I mean, truth be told, if you can't pay a bill, you can't pay your mortgage. Now you're worried about if your light's going to get cut off, is there food on the table, is there going to be a roof over my head come tomorrow? So that would help with some of the stressors. But we also are dealing with a perpetual cycle sometimes of an ongoing history of domestic violence. Sometimes the abuser, that's all they know. Sometimes for the person that's being abused, that's all they know. It becomes almost where they become complacent. Even though that is one stressor off of their plate, now they're looking at the next thing that's causing stressors. So it's definitely that abuser needs just as much counseling as the person that is going through the domestic violence themselves. So yes, financial do help, but if that is all that person knows, or those people know, unfortunately, we're now looking at a fact of, well, I got mad at you because you ate my sandwich, or I got mad at you because you didn't make the bed, or you didn't clean the house like it's supposed to. There are so many other factors when we're looking at domestic violence that finances is only one. That person may not like how that person disciplined their child, so that's a whole nother abuse in itself, because sometimes the partner isn't the only person being abused. Sometimes it's the child. Sometimes it's the children that's also being abused. And the worst age, or the ages that I've seen when children get abused, is during the potty training ages. So you're adding that stressor. If the children are little, you're adding the stressors of kids not being in school on top of, okay, now we got the money that we need, but that's not the only factor that's causing this domestic violence in the home.
Yeah, I absolutely hear that. And I appreciate the fact that you include the person committing the violence in the need for counseling and work. I strongly believe in restorative justice, and I know that forgiveness is a touchy subject, particularly around this issue. And it's so important to still show compassion to all people, because at the end of the day, all of us are people that need other people. That's what it boils down to. Judge, I'd like to invite you in this conversation around the issue of child abuse, and what have you seen happening as a result of COVID or generally in regards to that?
I would have to echo the prior panelists in indicating that we've definitely seen a rise in child abuse cases, I think, across the board. And it's been unfortunate. Some of the things that have been talked about, especially during this COVID era, is that you don't have children in schools, you have parents in the homes, and there are so many different stressors, because when you send your child to school and you have free reduced lunch, your child is getting breakfast and lunch and you're responsible simply for dinner. And although our schools have been doing their best, and the school district and the community at large, I think, has been doing an amazing job at still trying to have those food sources, what is missed in that is the transportation piece. The children who are bused, the individuals who don't have cars. So when you start looking at lower socioeconomic status, providing food at the schools is a very great thing. But during the school hours that your child is supposed to be at home online, if you don't have a sitter or you don't have transportation, those are things that are missing from that piece. And so you have individuals who are struggling financially because they don't have the jobs, and they have additional weight on them by trying to provide things that they're not used to. Additionally, I will self-admit that I have 4 children at my home who are homeschooling, and our ages range from age 3 through 12. So I have middle school, I have elementary school, and I am a professional. I have a doctorate degree, and yet and still trying to teach 4 different children in a home that is large enough to accommodate each of them to have their own study space, I have found to some extent challenging. They teach math in a whole different manner than which we all learned it. And I've actually gone through some of those sessions with teachers to figure out, okay, how are you now teaching this? And so I commend the teachers for what they've been doing, but we've also seen parents trying to become teachers' assistants and other things. And when we have teachers who would normally be able to see these kids and report if there's something going on with them, what I have seen, what I've heard, what I've experienced is that children are often turning their cameras off. And so we're not having as large of an incidence of being able to monitor that. And the other thing that we've talked about and touched on is that domestic violence is not just physical. And so I think that we need to discuss the emotional and the verbal. And when people are frustrated, when they're in these small environments and there's no space and no one has a room to themselves, it really allows kids' tempers to flare and adults' tempers to flare. And there's no outlet, there's nowhere to go, there's nowhere to take the children. And so it is a very difficult environment for everyone involved, inclusive of professionals, inclusive of people of higher socioeconomic statuses. But one of the other pieces that I wanted to touch on is the fact that looking at also mental health and substance abuse as a contributing factor with regard to why and the underlying incidences for the violence within the home, be it physical, verbal, or mental and emotional. And when you were talking about resources, one of the thoughts that I had in my head was, I wish that we had resource centers right next to hospitals, or at a minimum, the hospitals need to have these handy packets that talk about housing and childcare and ability to get food and things like that, because we've been discussing how the individual who is in a horrible situation keeps going back. And oftentimes what we see in the legal context is that sometimes the victim is unable to report or doesn't want to come forward or go testify at a case because they're going to lose their housing, they're going to lose their only income, their child's not going to have food. And so it's a lot bigger than just, I'm in a bad situation. And until we address the situation holistically, then we're going to keep seeing these reoccurrences. So partnering with being able to touch on each of those. How do we get these people food? How do we get them shelter? How do we get them clothing? And how do we get them job resources, school resources if they're uneducated and won't qualify for any jobs? It's really important. The other thought that I had during COVID is all of the locations that we've had empty, the hotels and the motels and things that haven't been at full capacity. And if there's any way to start partnering with individuals who have, if there was something where hotels or motels even gave 3% or 5% of their rooms that would be open for people who are in emergency situations, then maybe SafeNest could place them or different things like that. So we have to start thinking outside of the box to address not just one issue, but multiple issues.
Absolutely. Yes, yes, yes. And that actually speaks to my earlier question around providing financial support. If basic needs are met, it is easier for someone to leave. And that's just the way that it is. And so we need to create a system that creates security for everyone. And I really hear that coming from each of you in different ways, where everyone has to feel supported. I was on a call earlier today with the most brilliant children in the universe, and we were talking about compassion. And one of the children said that, well, compassion is making other people feel included. And I was like, wow, yes, that's exactly what it is. When everyone feels included, seen, heard, and knows their value, that's when we'll really see true change. So I want to kind of piggyback on an earlier question, and this is for the chief. With the domestic, or excuse me, with domestic violence and in really any incidents, if someone is fearful about their immigration status, they may also be afraid to contact authorities for help. Could you speak to that? And then maybe Brianna, you may have something else to add as well.
Certainly, and I know there's a perception out there, and again, this is another nationwide issue, and I can tell you from our agency's perspective, when we respond to domestic violence situations or domestic situations in general, we are not looking at any type of immigration enforcement whatsoever. We are there to stabilize and tranquilize and do whatever we can to help that family or to help that situation to get better. So we are not there to identify folks for the purpose of finding out their immigration status. That certainly would, number one, that would only lead to more people being fearful of bringing these incidents to the light and not allowing us to direct people to the assistance that they need. So, and again, that's certainly something that we need to make sure we do a better job of letting people know that that is not our purpose when we're responding to a call for help. We are there to help and not to deport. And so, I just think that the more we can get that message out in every form, the better. But just to reemphasize, when we respond to domestic situations, we are not there to enforce immigration laws. We are there to help that family or to help that couple or to help those people to resolve that situation in a peaceful manner.
Thank you. Brianna, did you have something to add?
Yes, I can jump on here as well. So in our practice or the practice of law and the clients that we see, we do hear those concerns echoed by many of our clients when we ask for the history of domestic violence in their cases. A lot of our clients will say that this domestic violence has been occurring for many years, but have never sought law enforcement assistance, or they were afraid to contact law enforcement due to their immigration status or specifically their immigration status and things of that nature. So I think that brings up a really important topic and really destigmatizing individuals knowing that they can contact police, that they are as was stated earlier, not that these reports would not be affected by their immigration status, that this is for them to report the incidents of domestic violence. So I think that's a very important issue to be brought to light, that there are a lot of individuals in the community who are afraid to report domestic violence because of the immigration status, along with any other reason for why they do not seek police assistance. But thank you for bringing that to light. I think it is a very important issue to touch upon.
Absolutely. And that was a question from our attendees. So thank you for that. We are coming to the end of our program tonight. I want to say thank you to all of our attendees and a very big thank you to our panelists for such a rich and robust and educational conversation around this subject. As we close, I do want to put a reminder out there to take the survey about tonight. We value your feedback and want to hear from you about future topics, and also if you have found value in these programs. But before we close, I do have an additional question that I'd like to throw in, and it is around gospel singer Kirk Franklin. Many people have heard his music and admire him as a person of faith. Whatever the religion may be, he is still kind of an icon of faith. And recently a recording of a conversation was released between him and his son, where he said very harsh words that I will not say on this because I don't want to get us kicked off Facebook, but not something that you would typically expect for a father to say to their son. Or then again, it is kind of something we expect, because as I watched comments and heard people talking about it, they were like, that's just how Black people talk. And for those that may not have heard what he said, he said, I'll break your neck, and a series of cuss words and some other things. I want to hear from the panel on that cultural norm around verbal violence and any tips or ideas around changing the culture to be one that does not inflict trauma generation upon generation.
I mean, I'll start it off, and I'll be quick, be precise. Actually, as African American male, I grew up in a environment where there was a lot of verbal abuse, and then as I looked around, a lot of my other Black peers growing up, kind of had some of the same experiences. And even when it came to the discipline piece, I would say today the way I was disciplined when I was growing up, would be considered abuse, physical abuse, child abuse today. It would be. I'll be clearly honest. And one of the things within Black culture is spanking is something that was very prominent. It was, and one of the things that I always said to myself growing up, because of the way I was made to feel after going through that, just the hurt, the pain, the trauma that came from being spanked by my parents, it really resonated for a long time. And so I always said, the day I become a father, I'm not going to spank my kids. And obviously, as a professional, I have more awareness in terms of education out there and the research out there when it comes to punitive, discipline measures and whatnot, and even the emotional discipline or abuse that goes with that. And so for me, it's something that I saw all the time. And again, just because it was something that was paramount in our culture or African American culture, doesn't make it right at all. And so I just want to put that out there.
Just because it's what our parents did does not make it right. That's what it boils down to. Would any other panelists like to address that topic?
I can. My dad was in the law enforcement. My father was a police officer back in Indiana. So, I mean, I saw the video of what happened between Kirk Franklin and his son. And I mean, my father was this big, burly, 6 foot, 300-pound man. And all he had to do really is raise his voice at me and I'll cry. But I saw how harsher he was with the boys. I am the only child of my parents, but we're like totally the true Brady Bunch. So my parents had three other kids, and then they had me. Each of them had one boy, but I seen so much harsher how my dad was with the boys than he was with the girls. And and again, it does definitely come down to our culture, or some of our cultural things, and we have to really decide if we're going to continue that cycle. And it does come down to education about, because I honestly think that there needs to be a parenting educational classes, especially like if a woman is pregnant or things like that, so that she can identify certain things that lead to abuse, whether it's domestic or whether it's child abuse. Um, so those are things that I do understand that it is part of our culture, but I also think that somewhere down the line we have to break that cycle. And how we discipline our children, like I know I disciplined my children much different than how I was disciplined growing up. uh my voice changed. They were put on punishments probably longer than I would have liked them to be on punishments, because when they're on punishments, you're on a punishment because you can't leave the house. But for the same sake, it is part of our culture. But I think that there's somewhere down the line that education and counseling, or parenting education, is vital.
Yeah, thank you for sharing that. So appreciative of your transparency.
Mm.
I would like to invite anyone else that wants to share.
I'll share briefly. And I was looking for this book while we were talking about this. I want to speak to the spiritual aspect of it. If you are an individual who believes in God, believes in Christ, or is spiritual in any nature, then you have to understand and recognize the power of words. And if you look at biblical verses in Genesis, and it talks about how God created the earth and the stars and all of those things, and a lot of it he spoke into existence. And I'm drawing that parallel because you were speaking of Kirk Franklin and being a gospel individual. And so I think that it's time for us to really realize how powerful our words are and how you can speak things into existence, both positive and negative. And there are a lot of affirmative and meditations and things like that that teach the same principles without the spiritual aspect. There's a book that I read recently called The 40-Day Word Fast. And I am not connected to the book in any manner, but I found it to be very enlightening as to the verbiage and the words that we speak. As a parent myself, I think one of the things that I've tried to do, my husband and I have tried to do in our own household, is to stop that whole cultural thing where, kids are not allowed to talk or express their feelings, or when they ask why, it's always, I told you so. Now, after about the 10th why, it may be because I'm the parent and I told you so. But inviting kids to have an opinion and to value that opinion and to listen to them is instrumental, because even if you are saying those words, it may be the child, if you have that relationship and you invite them to share their feelings and you value their opinion, they may be able to say, hey, mom, hey, dad, hey, grandma, whomever, that hurts me. And that can start the process of healing. So I think that that's important too, to stop, the cultural thing that children shouldn't have an opinion or they shouldn't talk and they're just always to do as told. There's also some different books that talk about children obey more when they feel respected and they feel loved. And part of that is being heard. And so I think that that's just extremely important, that we get away from those very negative and aggressive tones and verbiage with our children and try to have a balance. If you think about any profession or any job you've ever had, if your boss is always speaking negatively to you, you're not going to like that environment. And yet I think within our culture, we tend to always nag and talk about the negative things that our children are doing or our spouses are doing or what have you. But having a balance to really give them that positive feedback as well will help to eliminate some of these cultural norms of, that verbal and negativity.
Absolutely, Judge, that was so well stated. And thank you for sharing that resource. You bring to mind a idea around how when Africans were enslaved and brought to this continent, how the mothers then learned to say, oh no, you don't want that one, he's dumb, and he's no good. And then that was a protective mechanism to keep the family somewhat intact as much as possible. But that was never broken once people were freed. So some things we're doing, we don't even know why we're doing them. We just know it's been that way. So I thank you for highlighting that. I'd like to invite Marie Wakefield to share a few thoughts as we close tonight.
Thank you very much. I have spoken with each of these panelists, and I want to say that this has been a great conversation. It's been a different conversation because we have a lot of times when we do our domestic violence presentations, we look at signs and symptoms, we look at ways for prevention, we look at resources, and so the things that each of you brought to the table were quite real and quite experiential, and things that we can absolutely share with others. This is a taped presentation, therefore people can go back and revisit this and get some other information. And we know that because of the pandemic, things have been a little bit different. And so I asked each of you to come to this table because I knew that each one of you would come from a different perspective. So I am very grateful that you would give us your time and your expertise to share these things. We know that as we are recognizing this pandemic, how people have been in closer proximity, and sometimes domestic violence is reported and sometimes it's not. Abuses are reported and sometimes it's not. But each one of you can see it from a different perspective. And what you are bringing to the table as a resource for our community is totally valuable, so invaluable, and I just want to thank you for that. So it doesn't mean that we're walking away. All of you know, at least I think you should know at this point, that Nevada has ranked very high with domestic violence, and we need to figure out ways that we can work on reducing our rate. I mean, to be in the top 10 or even to the top 5 for so many years, it means that there's something that we're not, or we may be not be doing as well as we could. And so so that's why I just wanted to make sure that we come together and we talk about things and we bring it to a very real perspective. Delta Sigma Theta Sorority Incorporated has been committed for the past 8 years. We've had sorority sisters that we've lost due to domestic violence. And so we want to bring greater education, awareness, and resources to the community. We have a program called STOMP, which stands for Standing Together Opposing Misuse of Power. And so what I make sure that I do when I try to work with this program as the chair is to make sure that people not only are educated into what they can and cannot do, but where are the resources. I'm not sure that our community has enough information in that area, and I just want to keep putting it out there. So I am so grateful for each of you and all that you shared tonight, and how you will help us move forward in trying to address this community dis-ease, because that's exactly what it is. Every one of you have brought an invaluable resource tonight, and I just want to thank you.
And thank you for putting together the Dream Team panel, because each person really did add a perfect element. We'll call this the gumbo panel, because each flavor was definitely there, but still unique and brought that perspective. I also want to thank each of you for being here, and for our attendees for being here. And I do encourage you to share the recording of this. More people need to hear these type of conversations. And I also want to remind you, that you are not just a drop in the ocean. You are the entire ocean in a drop, and what you do matters. So wake up to your greatness and know that you are worthy of freedom. You are worthy of love. You are worthy to simply be exactly who you are. So wake up and be great. Thank you all for tuning in, and we hope that you will attend our next webinars. And I also want to say one final thank you to all of our tremendous sponsors. Without them making this possible, we wouldn't be able to share this information with you. So with that, we'll sign off and wish you a good night.